Good morning. Thank you, everyone, for joining us on our Mental Health Matters Forum. We'll take a couple seconds to let everybody come in. I'm your host for today, Eva Shaki, and we hope you will join us each first Friday of every month at 11:30 for a new topic and conversation. Today's topic is mental health and foster care. So I want to tell you a little bit about SC Thrive and our mission statement. SC Thrive leads South Carolinians to stability by providing innovative and efficient access to quality of life resources. What does that mean? We help individuals in a crisis situation find sustainability and meet their goals. Today, we have Carolyn Vaughn, who is a licensed professional counselor who works as a treatment supervisor with South Carolina Youth Advocate Program. Hi, Carolyn.
Hello, everybody.
Foster care children are just like any other children. They're like your children, but they've experienced more difficult situations and hard times than most adults ever will. Some develop emotional and behavioral problems, and sometimes even challenging behaviors. Most have created tough outer shells to protect themselves from hurt and rejection. The children range in age from birth to 18 years old, and sometimes it even ranges from birth to 21 years of age. Most children in foster care are temporarily placed in foster care, but they need nurturing families, homes for the duration of their stay in foster care. Some children in foster care are waiting for adoption and are in foster homes, group homes, or treatment facilities. They need families who will give them a home lasting until adulthood. So, Carolyn, how does foster care affect the mental health of a child?
I would say that children in foster care experience a lot of grief and loss. You can imagine being taken from your family, your friends. You're more than likely in a different school. You've lost a lot of your personal belongings. So there's a lot of grief and loss that they're going to experience. They don't really understand what's going on a lot of times. They can blame themselves. They get moved around, unfortunately, in foster care sometimes to different homes and different placements. So they have a lot of instability, and they do lose a lot of educational and health gains that kids normally would be getting. They get a setback every time they get moved. They get set back in that. And then just whatever they've been through, they probably have been exposed to trauma, and they're exposed to abuse and neglect. That's why they're in foster care. So they have all that going on. And then they also have the stigma of being in foster care, being a foster child. And that affects them with, when they go to school with their peers, and then, when they in the community with their foster parent, that also affects their identity and the way they feel about themselves.
So, now I'd like to cover some foster care myths about children in foster care. Number one, all foster children are bad, juvenile delinquents, and runaways. That's one of the greatest myths about foster children, is that they are in need of a home through some fault of their own. A common misconception about these children is that they are bad, aggressive, violent children and nobody wants to handle them and nobody can handle them. This is simply not true. Many of the children in foster care have been in a tough start to their life, and as a result need support to heal. The children's reaction to trauma they may or may not have experienced is as varied as the child. Some children act out, some children withdraw, some resolve to live as if nothing ever occurred. Foster children are carefully placed with families capable of helping them heal, and foster care agencies provide support to both the child and families. The most important thing to remember is, like all children, foster children are resilient. All foster The second myth is all foster children have been sexually or physically abused. Over half of the children removed from their homes and are moved to due to neglect. It is unfortunate and true that sexual and physical abuse does occur. However, most children who experience abuse are primarily neglect. Recent national increases in adult drug use has caused an increase in children being removed from a home due to an adult drug use and parental incarceration. Despite the reason a child is placed in foster care, it is important to remember foster children need love and are often removed from their home through no fault of their own. Carolyn, why does placement matter?
And that's one of the things that I help with at my agency is trying to make the right match for the child, so that upfront that we have the right environment for them, depending on the needs of the child, so that we don't have those placement moves in foster care, and that we need definitely diverse families because we have a set of diverse kids, and some kids may do better in a more rural setting. Some may do better in, where there's more opportunities for jobs. It just depends on the child and what's going on. A single mother might be a better match for a teenage girl that's been sexually abused, for example, by a father figure. So it just depends on what's going on with the kid and what the right match is. And then everyone has all the foster parents have what their tolerance level is, what they feel like they're better at. So we have foster parents that only take in teenage girls, for example, or only take in boys under the age of 12, and that's what they do feel like they do better. So it's just all about finding the right match, hopefully up front, to have the kids be more stable. Sometimes kids get moved for normal teenage behaviors or normal kids behaviors because they are in foster care and they're under this lens of everyone's watching them, and if they start acting out or having behavior issues that may be normal, like a teenage girl may do something stupid like sneak out or get into trouble at school. That's a pretty common behavior with teenagers, but a child in foster care would have maybe more repercussions. And so getting the foster parents to understand that, and being able to tolerate whatever it is they have going on.
Thank you.
You're welcome.
So now we're going to talk about myths regarding foster parents. There's a lot of myths out there, but we're only going to cover 3. One myth that a foster parent might hear is they can never be a foster parent because they're not married and they don't have a lot of money, or they don't even own a home. There are no such requirements. You can be married, single, a homeowner, a renter. The only financial requirement is that you have enough of income to support yourself and the family aside from the money you are reimbursed to care for a child living in foster care. A second myth is foster parents have to stay at home with the child, and if you work full time, you're excluded. That's not true. It doesn't exclude you. Many foster parents work outside the home, and you can discuss with a licensing agent what options may be available to you to assist with childcare costs. Another myth is I don't have any children And to be a foster parent, you need to have parenting experience. Not true. Many foster parents are childless. They are, however, responsible people who have made a commitment to children and demonstrate an ability to parent or a desire to learn parenting skills. So, what are some services that are provided to families that want to become foster parents or that are foster parents?
So with South Carolina Youth Advocate Program or a therapeutic agency, we have a worker that's called a treatment coordinator, and that treatment coordinator is assigned to the home, and they provide what's called family support services to the foster parent. So they're your go-to for, talking to someone about the child's behavior, trying to get services in place, medical, school services, all those things. And really we're support for you to be able to just vent. Sometimes you need to be able to talk about whatever it is that's going on. And so that is what we do. We have that treatment coordinator that does that, and they'll help navigate. So all of our therapeutic kids have some sort of mental health diagnosis, so they're going to need counseling. So helping you identify counseling services and getting that set up. School, they may have learning issues that might need to be tested, or they may need some different services to the school. So we can help navigate that and how that works with the school. And so we really just try to give you support, ongoing training if for that specific child and whatever their mental health diagnosis is. We can help you understand that and their behaviors. And so that is what really makes therapeutic foster care work, the help of that treatment coordinator. There's also ongoing training. There's crisis prevention intervention that we have once a year, CPR and first aid every 2 years, and then just ongoing other trainings that are required to just keep your license current and aware of some of the issues going on with kids. But yeah, so that's how we help.
Thank you. There are a range of mental health issues that is evident among foster children. It's vast and varied, and includes post-traumatic stress disorder, which is known as PTSD, panic and anxiety disorders, major depression, and sometimes even drug and alcohol abuse. And while it seems natural that these issues might emerge as a child ages and reaches adolescence, what may be surprising is how early they arise and how prevalent they are in a very young person, those under the age of 6 even. Unfortunately, mental health tends to be polarizing, a lightning rod fraught with controversy and remarkably differing priorities among those who are most impacted by the decisions: the children, parents, grandparents, foster care parents, clinicians, and even the court system. These differences appear pronounced in areas like access to services, the cost effectiveness, and public policy. A common feeling is that these parties exist not merely on different continents, but perhaps on different planets. Parenting is a balancing act, and so is being a child in foster care. One of the most common burnout factors is when a parent is lacking of emotional attention from the child, accompanied by destructive and targeted behaviors. They must remember that the child or the adolescent often acts out when they are scared. This doesn't necessarily mean they're scared of the foster parent, but it could mean that they are terrified of being in a new environment and not knowing what comes next. How can a foster parent aid the child and become more comfortable in the new environment?
So usually the kids go through, when a placement comes in, they go through what we call a honeymoon period, where they're just getting to know the family. They tend to be on their best behavior, and sometimes the foster parent may be tempted to give the child a lot of things, a lot of attention in the beginning, and then life goes to normal, and everyday life starts kicking in, and you may start seeing some behavior showing out, coming out of the child. And this is normal, and this is actually the good part. When the behaviors come out, I think of it as, this is an opportunity now for you to work through these issues with the child and help the child. A lot of times they don't understand why they're feeling and acting the way that they are. So just understanding the process would be a good tip. We give you some training and support on how to set up rules in your house, so that the child knows what to expect for all the different behaviors they might have, and what the consequences if they don't do certain things, or what rewards they have if they do certain things. So maybe have those rules posted or go over with the child, and just know that you're going to need a support system for yourself. So the most successful foster parents, or when I see that it doesn't go well, is when they don't have that support system. They don't have people that can help them, alternate caregivers that can step in when the behaviors start to come out. If they start acting out in school, for example, having a backup plan of what's going to happen if your child gets suspended from daycare or school. What's going to happen when you need a break, So having a support system for yourself is very important. And just know to expect that real behavioral change with a child takes a lot of time, and not to take their behaviors personally, because they've only been with you probably a short time. And so if they're 7 years old, they've had 7 years of life without you, and they've learned a lot of maybe negative behaviors, and they've had a lot of turmoil going on in their life that has nothing to do with you and your home. So not taking the behaviors and things personally is very important.
So therapeutic parenting is something that I've never heard of, but in researching this topic, I learned that therapeutic parenting can be used and is an important skill for a foster parent to have, and it's most helpful when responding to situations as well as being proactive. So some skills that are needed are a calm tone. You need to watch your facial expressions. Use positive rewards for desired behaviors. Do not use sarcasm, physical punishment, or negative measures. And understanding is paramount. And always have an open attitude. Have clear rules and expectations. Follow through, and follow through every time. Consistency in rule implementation and consequences is almost needed every time. However, you must be aware when a rule does not work and be ready to change. If something doesn't work, don't keep trying it over and over. Just adjust. Doesn't mean you're a failure. Therapeutic parenting is about setting firm limits in a manner that is gentle enough to appeal to the child's emotional needs and developmental stage, and is strong enough to ensure felt security. Follow through with what you say are going with what you say and what you do are going to do is also critically important. This teaches the child that they can trust you and they can trust what you say. They learn by your modeling that they have to follow the rules and there are consequences for their choices they make. By implementing positive and therapeutic parenting techniques, the parent will feel safer in the environment, and so will the child. The hard part is the implementation and the follow through. Can you explain the crisis prevention intervention?
Yeah, so CPI is a separate program that is used as an international program that's used in various places. Horry County Schools uses that. Mental facilities like residential treatment facilities or group homes. Our therapeutic foster parents also are trained in crisis prevention intervention, and it walks you through all the stages of a crisis and gives you some tips and tools that you can use in each stage. The majority of the training is about verbal de-escalation techniques and things like understanding your body language and understanding how to approach people or children that are in crisis. So we have requirements that our foster parents and our staff take crisis prevention intervention initially, and then renewal once a year.
So, a call to action is get to know what your region or what your county has in place for foster care and adoption licensing requirements. In South Carolina, each facility has their requirements, but South Carolina has a criteria and steps for becoming a foster care or an adoptive parent. Number one, the applicant must be at least 21 years old, and you must complete and return the application to your regional office that serves your resident county. Complete a SLED and fingerprints and child abuse central registry release on all members of the household at least 18 years or older. Attend 14 hours of preparatory training to help with self-evaluation of the types of children with which you'd be placed or would fit in your family. You have to pass a fire and sanitation inspection by the fire marshal and DHEC. And there's also home visits. So if you're interested, we do have information on our resource page during this class. However, as I asked the last question, I will proceed to the next slide so everybody can get the resources. But I will ask the last question of the day. What is the biggest need in foster care, Carolyn?
We have a really big need, especially with therapeutic foster care, for people willing to work with the teenagers, and also LGBTQ youth, transgender. We are seeing more of that, and it can be difficult to place teenagers and LGBTQ children in a home that's supportive and understanding of what they're experiencing. So we really desperately need that as well. So a lot of people go into foster care wanting babies and little kids, but we have a lot of teenagers that need a placement as well.
And like I said, our video for today will be posted on our Facebook and our YouTube and LinkedIn. So you will be able to get the resources from those platforms as well. Last but not least, we want to hear from you. So, Barbara, do we have any questions in the chat?
We do not right now, but we do welcome if you all have any questions for our guest speaker, Carrie Lynn Varn, regarding foster care or children's in foster care as mental health. There is a chat you'll see at the bottom of your screen, and there is a Q&A as well.
And we also have a survey about mental health matters, our form. Oh, I see we might have a question in the chat.
Oh, I said no questions at this time.
Oh, okay. We have a mental health form survey. Tell us what you liked about our mental health forum today. You can tell us even the topics you'd like to see in an up and coming mental health forum. Also, if we didn't do a good job, you can tell us the good, bad, and the ugly. And I do see that we have a question in the Q&A.
Yes, ma'am. So Ashley has asked, is counseling available for children through your services? So is there counseling available for the children, the foster care children themselves?
There's different places where counseling is available. SCIAP as a state agency has also counseling services. Depending on the area that the foster child is placed, we might have some clinicians in our office. We're definitely doing telehealth right now. But we also have identified other counselors outside of our agency that the kids see. And a lot of times the foster parents will use the same counselor for the different kids that they have in their house. They start developing a relationship with that counselor. They have a preference for that particular counselor. And so it's somewhat flexible, but there are services available, and telehealth has made that even better.
And in the chat, Miss Virginia would like to know, can the children be adopted that are in foster care?
So the road to adoption is a very long path. So if anyone is interested in adoption, I would definitely encourage them to do foster care first, because before a child is legally free, they're in that system for usually a long while. The court system wants to give parents and family members as much opportunity as possible to, remediate whatever it is that brought the child into foster care. They want to exhaust all relative placements first. And so a child may be in the foster care system for quite a while before they're legally eligible for adoption. But that doesn't mean if you get a foster child, you just never know. I always tell my foster parents that are new that it's a journey and you don't know where it's going to end. So you have to really be open for that. So a lot of our kids do eventually become, not always, but some of them, it just depends, become legally free, and the foster parent can go through DSS to adopt. If you get licensed through DSS, I believe they do adoption and foster care kind of at the same time. With SCIAP, we do just therapeutic foster care, but you can apply to adopt. And of course, if you've had a child in your home, usually you're going to be the number one person that's eligible to adopt that child. So I guess yes, maybe is the answer.
And what is the difference between therapeutic foster care and regular foster care?
So all of the therapeutic foster children have a mental health diagnosis. They've been approved and had what they call a diagnostic assessment to figure out what's going on. They tend to they're going to have some more extreme behavior and emotional issues. So just because they have a diagnosis doesn't necessarily mean they're therapeutic. They also have to have, that there's something extra going on with them. And so that is why we have the treatment coordinators to help work with the home and the extra training and support that a regular foster care child would not need or have. So regular foster care children tend to be better adjusted. Maybe they're not have gone through maybe the more severe things that our kids have, or maybe they just have less genetic mental health stuff going on with them. But, they're all just kids. So really, when it comes down to it, they're just kids, and they just all need the same thing, which is a family and love and acceptance and support.
Lisa Davy asks, can foster children leave the state if a foster parent needs to move?
That has happened a few times. It just depends. It was going to be up to that specific case and that situation. It's not very often that happens, but it can be done if everything is, everything works out well. I mean, they would probably get licensed in another state and transition, and everyone would have to be on board with that. But if a child is getting ready to, maybe reunify and go home, they probably would just move to another foster home, if that makes sense. The licenses are per the state, so there has to be some interstate cooperation with licensing stuff.
Thank you.
What about if the family isn't moving, but if they're just like going on vacation out of state, are the foster children permitted to go with them?
Oh, absolutely. We definitely encourage anything that a normal family would do. We want our foster families to do. So if you're going to New York for a family, some type of family event, absolutely. You just need to notify the worker what's going on and, make sure that it's okay, but it's going to probably be okay unless there's something else going on. Sometimes children may have like a juvenile justice, like probation order. So they might have to get permission from probation officer or whatever. But for the most part, we want and encourage our children just to be like any other family and do fun things like that.
Thank
That's
you.
awesome.
As you see on the screen, we would like to point out that we have mental health first aid for adult and youth certification. It is a 3-year certification. And if you can see the link, Miss Virginia said, how long is the licensing process for parents?
That is a very good question. It really depends on how organized and motivated the foster parent is to get things done. But it is a process. So signing a bunch of papers, doing training, getting a physical from the doctor, getting background checks back. It can all take time. I've seen it take as little as 2-3 months and as long as 2 years, maybe, although things expire after a year, so everything would have to be redone again. So I guess I would say average 2 to 9 months, but it depends on the person. There's paperwork you have to fill out that no one can fill out for you. You have to do that, and like the physicals and getting like the right fire extinguisher and getting the fire marshal scheduled. SkyUp is really good. We're really good about trying to help you through that process because it can be overwhelming. It's a lot, but it is very doable. You just have to kind of be motivated to get through it. But if we try to help you through that as much as possible.
And what are the most common mental health challenges that you see with the children that you work with in SkyUp?
We get a lot of our kids have ADHD diagnosis or behaviors. We have a lot of depression, trauma, anxiety, mood disorders, oppositional behaviors, where kids are they just don't follow directions because it's just the way that they respond. That can be pretty challenging. I would say those are the biggest ones that we deal with. But they're, underneath it all, they're just kids, and they just, they just need the same things. So.
Are there upfront fees for the parents, the foster care parents?
Not really any fees. It's just a matter of like getting your physical. You have to pay for that. That can be a financial, problem for some parents. Getting the right fire extinguisher. A lot of times you have to buy that because you probably don't have the one that they want you to have. Might have to get like smoke detectors that are different than maybe what you have in your house. So that's really the cost. And, in getting the bed set up and the dresser and whatever else you're going to have in that room for the child or the rooms for the children can be a little bit, but there's not any real fees. Background checks are covered. Anything that, can be covered is covered. But really the stuff in your house is what you have to take care of.
You said physical. Is that a physical for the foster parents? And then would that be just the same as like their annual physical?
Yeah, there's a specific form that you have to get filled out by the doctor, and it's for all household members. So parents have a certain one, other adult household members, like if you have a grandmother that lives with you, children, they all have specific forms that need to be filled out. And really one of the big parts of that physical is the doctor. There's a couple of questions on there on the parents one that says, is this person have any physical limitations that would keep them from parenting a child, something along those lines. And that's what they're really looking at. So yeah, you can have, any of them, we all have medical stuff. So I think sometimes people are just kind of hesitant because they think that, if they have high blood pressure, that might rule them out or something. But no, they're not really, they're looking for anything that would be a contagious disease or that would rule you out from parenting, like some type of physical limitation. So that's what they need that physical for.
Can you tell us about the respite care?
Yeah, respite. We use respite if the best way to use respite is if it's a planned respite. So let's say you're going out of town for Mother's Day weekend, and this, it's great if it's planned a couple weekends in advance. And so we have other foster parents, and it's just a matter of you being willing to do respite for people and them being able to do respite for you. And the kids tolerate that usually pretty well. They'll go, we have other foster homes that we could use for respite care. Sometimes we have respite care in an emergency or crisis situation, but that's going to be a little bit more tricky because it's if the foster parent's willing to do that care. And we don't like to move kids when they're in crisis because they really need to go through the whole cycle and try to reconnect with that parent that they're having that crisis with. So we talk about that with respite, but respite care is available, and that's why that support stuff is really important, because other foster parents can support you, and you have alternate caregivers that are identified as well that can be a support for you, and that identify that through the licensing process.
Okay. Do parents need training in mental health?
They get that. They definitely, that's part of one of the things that we train on, because you're dealing with children in therapeutic care anyway that have some type of diagnosis. So we do ongoing trainings about that.
Barbara, do we have any more questions in the chat or the Q&A?
I think that is all of our questions that we have right now. We do thank you all for being with us today and spending the time with us, asking those important questions. With the mental health first aid that Eva has just put on the screen, note that we do have adult and youth certification, and the youth certification is for adults who work with youth or parents who work with youth. So if you're contemplating foster care, that would be a great program to sign up for. And it's available at no cost right now, thanks to the Blue Cross and Blue Shield Foundation of South Carolina.
And also we have annual training coming up, and it's September 27th and the 28th in Charleston. It is going to be an in-person conference. And our topic for this year is unraveling social determinants of health.
And we have our early bird pricing on through May 15th. You can get a registration ticket for just $100. Is that correct, Eva?
Yes, that is.
And Sherry said in the chat, thank you. This was very informative for her.
Thank you for coming. And we'd like to thank our sponsors, because without our sponsors, we couldn't do what we do on a day-to-day basis. And not only that, we couldn't put on this Mental Health Matters forum. So thank you. Also, if you'd like to reach out to SC Thrive, you can call us at 800-726-8774. You can check us out on Facebook, Twitter, Instagram, and YouTube. And check out our website at scthrive.org. Thank you all for participating in our forum today. And this concludes our forum.